This day last week, Minister, I attended a protest at Cavan General Hospital, and that protest was held by workers from across the hospital. So there were nurses in attendance, clerical workers, porters and healthcare assistants. They were represented by 3 unions, Forsa, SIP2 and the IMNO. And the demonstration was held as a first step in opposition to the pay and number strategy introduced by the HSE during the summer, and the fact that all positions which were unfilled as of the 31st of December 2023 are now declared obsolete, or I think decommissioned is the words of the HSE. I spoke at length with different individuals there. One clerical worker there told me that she frequently works up to 3 hours in addition to her 9-hour shift to ensure that patient files are properly updated. Nurses are telling me that even on their day off, they get text messages, can you please come in and cover because we are chronically understaffed, and they know what it feels like to be in that position and they don't want to jeopardise the safety of the patients. However, they're jeopardising their own health and well-being because they're losing their day off and they're losing out on time with their families. Most of this additional work is not paid as overtime, it is done as time in lieu. But the difficulty is, when do you take this time in lieu when there's such a chronic understaffing? And it's having an impact on patient care. It's having an impact, as I've said, on the actual healthcare workers themselves. Many are considering going abroad where they can actually do their jobs without having to worry about coming in on their days off or doing additional hours. And I think there is, I think it's evident that the HSE and the Department of Health are trying to ignore the unions in this. The unions are there to represent the healthcare workers. And we saw what happened with the CDNTs, where the staff engaged in CDNTs were not talked to prior to the setting up of progressive disabilities. And it has been a disaster. And we're heading down the same route here if something isn't done. So we need to see realistic workforce planning. We need to see the HSE directly employing staff and to stop engaging agency staff, which is far more expensive. There is a clear road towards privatisation, and that has to stop. Thank you, Chair.